Now to something that's been called a miracle drug. It's a treatment that may extend the lives of some cancer patients by years. The NHS is prescribing Nivolumab in Scotland, but doctors in England aren't allowed to use it.
The organisation that approves treatments in England is expected to make a decision this week. Indications aren't promising because of the cost. It's the latest case of the health lottery that can decide which patients will have more chance to live and for how long.
Keith Akehurst has the story of a Northumberland woman who doctors say could benefit.
Fiona Fowle has life-limiting tumours. The 59-year-old from Blyth was diagnosed with lung cancer in November 2014. Since then it's spread despite having 2 rounds of chemotherapy and radiotherapy. There is a licensed drug that doctors say could extend her life. Nivolumab is made by an American company and trades as Opdivo. But treatments cost £5,700 a month, almost 10 times the price of the alternative. It is available 60 miles away in Scotland, but not in Northumberland.
I actually think there was something out there that isn't a trial anymore and is being proven to be good for lung cancer patients that I can't have, which is really, really upsetting. It's like playing Russian roulette with people's lives, you know what I mean?
Fiona is being treated at the Northern Centre for Cancer Care in Newcastle. Her doctor says he would prescribe Nivolumab if he was allowed. It's been called a wonder drug that uses the patient's immune system to attack the cancer. It's usually given after other medicines have been tried without success.
Well, this would be a good treatment option for patients like Fiona. She's got a high chance of her cancer responding, associated with very little in the way of side effects, and there's the potential, although relatively small, that it could control her cancer for a long period of time. In about 20 to 30% of people, you'll see major shrinkages in the cancer, even to the point where it can be quite difficult to see it on the scan. And sometimes that control can be long-lasting, many months or maybe even years.
But despite this, NICE, the body that approves treatments in England, hasn't so far sanctioned it.
I've been to see funeral directors to plan my own funeral, which was very, very upsetting for me kids.
NICE is expected to announce its final decision on Nivolumab this week. Keith Akehurst, ITV News, Northumberland.
Well, Jack Miller is from the Roy Castle Lung Cancer Foundation. It's the UK's only charity which is dedicated to that disease. Mr. Miller, we've heard there that Fiona Fowle's doctor would like to prescribe this drug if he was allowed to. So why is it available north of the border but not here?
Quite simply, the decisions taken where to prescribe drugs are taken north of the border, and then a different decision for England and Wales. And a decision is being made today whether Nivolumab will be able to be accessed by patients in England and Wales.
You're arguing that it should be made available, but surely you will acknowledge that the cost implications and the priorities that have to be made means that it's a delicate decision about costs versus benefits.
Yeah, absolutely. There's a whole heap of pressures on these decision makers. What we would argue is this drug is made available for less than 10% of lung cancer cases, so in the grand scheme of things the financial cost isn't as big as other decisions, and also the cost of not making this decision and making this drug available for patients has a knock-on effect for the patient themselves, their families, their loved ones, and for the wider community.
A quantitative cost, though, or are you talking about a qualitative cost?
Both. The quantitative cost, both for ongoing treatment, care, but also, more importantly, really, the love and emotion and the qualitative cost for people's lives as patients, but also for their families and friends.
And those people are all waiting to find out whether NICE will approve this drug. It might be sometime before they announce it. When do you expect to be given a steer on that?
We believe within the next 6 weeks.
How confident are you that it will be approved for use in England?
All we want to do is cross our fingers and hope and tell all the patients who have lung cancer that we're standing shoulder to shoulder with them and trying to fight for them on their behalf.
Mr. Miller, thank you for joining us.
Thank you.